Good Friday morning. Dr. Todd Bell joins me. We're talking about pertussis, and the increase in cases is actually prompting the state of Texas to declare a health alert.
Yeah, so there are certain outbreaks that we see that the state health department will actually issue an alert to try to get both the public and different physicians, individual physicians, to be more aware of what's going on. Pertussis has been around for a long time, but what we've seen is that this year in particular, we have more pertussis than what we've had in, I think it's been 50 years, or at least are on track to have that. We've seen that to some extent locally as well. We've seen a little bit of an increase locally, but most of the cases that they're seeing are down in the southern part of Texas. I think one of the real questions that people oftentimes have is, why are we having the outbreak this year? And I don't know that anybody knows the exact answer to that. Certainly we get concerned if we don't have a good vaccination rate, because pertussis is a preventable disease. That may be playing into it some if we've had some sliding on our vaccination rates. Otherwise, the epidemiology or the outbreak is something that oftentimes it's difficult to describe what the reason for it is.
Is there something that parents or teachers or anyone should be looking out for in kids?
There are. So we think about in kids who are unvaccinated and are kind of school-age kids, then it's the classic whooping cough. So cough, 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 and then a whoop sound as they try to get a breath in. In younger kids who are too young to be vaccinated, the muscles in the chest aren't strong enough to produce that whoop. So they actually present with, oftentimes, with stopping breathing, which is obviously a medical emergency, and they need to be in the hospital. I think something else that both parents and grandparents and teachers need to be aware of is that they can actually spread pertussis without having a lot of symptoms themselves. So we actually encourage every adult who has contact with kids to get a pertussis vaccination themselves.
All right, very interesting stuff. Thank you, Dr. Bell.